Hey, Patrick Commiskey in Albuquerque, New Mexico. This is a patient with Fuchs Endothelial Dystrophy. That's where you have these little bumps on the inner side of your cornea that can cause glare and decreased color contrast sensitivity. And then it can also cause some swelling in the cornea. Normally, those cells are what are responsible for keeping the cornea clear. So if you have Fuchs, sometimes the cornea becomes swollen or not clear, and that can cause some vision troubles. So here's the most common surgery that's performed for that. It's called DMEK or Descemet membrane endothelial keratoplasty. It's where we just replace just that inner lining of the cornea. So here you can see I'm stripping that the inner lining from the patient's cornea. This is all comfortable. I'm just removing that inner lining only. You can see at the very top of the screen there's a little um, port in there to just keep the fluid inside the front of the eye. Then at the very top of the screen, there's a teeny little hole in the iris. That's there just to prevent the bubble that we place at the end of the case from obstructing the flow of fluid from the back of the eye to the front of the eye, which would otherwise cause the pressure to go really, really high. So that teeny little hole in the iris there is meant to prevent it. So now we've got the surface stripped, and I've got the DMEK tissue here and a nice little injector. This case is actually a little less fluid than most of them. There's a little bit of an issue with just getting the tissue to clear the main incision, and ooh, heart skipped a beat for a second there, but did a couple maneuvers to help keep the graft where it belongs. And then here, rather than it, the graft kind of unfurling, untapping super smooth, I tap it out and notice that, oh, the graft is upside down. That's supposed to be an F, but it's an upside down F. So this was where, like I said, this case just takes a couple minutes longer than usual to get this graft to tap out and have the right orientation and be properly centered. Um, this is a surgery that we do, quite a bit nowadays, and is able to really provide a nice, um, recovery of vision for patients. Um, I guess in the olden days, before this type of surgery was available, you would just sort of have to wait until the vision was truly bad enough for entertaining a full thickness cornea transplant, where you would just remove the whole cornea and sew on a new one. So this surgery is just much less risky, um, and has much better visual outcomes. I would say most people expect maybe a 20/20 or a 20/25 type of vision after a DMEK. So really that's pretty good. So here we're just kind of doing the final little tap so that it's nice and centered. And then here's that air bubble that we put in. So we just get that nice little air bubble, and then I'll kind of make it a little bit bigger or smaller and make sure it's the right size and that it clears that little hole up at the top of the screen. And this patient's going to head out to the PACU area and then position so that the bubble stays where it's supposed to be. And that's the end of the case.